All right. So, good evening, everyone. Welcome again to the first official Moringa Masterclass. My name is Dr. Larissa Assam, and I'm a board certified family medicine physician. I'm also the founder and CEO of RoPMD, which is a virtual private practice. I take care of patients of all ages, all genders, but I do have expertise in chronic disease reversal and also in women's health. So, welcome, welcome, welcome. Just to share a little bit more about myself so you know who you're speaking to and kind of where I'm coming from as I'm sharing these things. I have a background in science. I have a bachelor's in biology and French. I went to school in upstate New York, which was very, very cold. I was born and raised in Cameroon and then moved to New York when it was time to go to university. And so I went from the tropics to upstate New York snow. If you have ever been there, you know what I'm talking about. And immediately afterwards, I continued in Syracuse, New York. I went to medical school at SUNY Upstate in Syracuse, New York. And then I moved down to Maryland and I completed my Master's of Public Health at Johns Hopkins Bloomberg School of Public Health. It was a great time. And I think it's one of the reasons why I'm so passionate about educating people about their health beyond just prescribing medications. I then loved the DMV area so much that I decided I wanted to stay in this area. And I completed my residency at Georgetown, Washington Hospital Center Family Medicine Program. And yeah, to share a little bit more about myself, I was born and raised in Cameroon. I decided I wanted to be a doctor when I was just 7 years old. And by God's grace, I get to live out that dream now. Immediately after finishing my residency, I started my private practice, Rofi MD. And I'm also very involved in leadership at my church, which is KFT. So if you follow me on social media, you might see me post about it a couple of times. All right. So, as we get into the content of today's session, I do want to start off with a very brief disclaimer. This is simply for education purposes. There's nothing I'm sharing that takes away the opinion of your own physician. Now, if you are in need of a physician or if you're looking to switch over to Rofi MD, I'm more than happy to have that conversation during a formal office visit or virtual visit, but I do want to start off with that disclaimer. Okay. This is really for educational purposes. Now, everything I'm about to share tonight is backed by science, and tonight's focus is really going to be on weight loss. We're going to talk about how it is possible to lose weight and how what the research is telling us. I'll specifically talk about this study. There was a research study that was published in a journal called The Frontiers in Nutrition. Okay, and it showed that when people did intermittent fasting for a period of about 2 months, so 8 weeks, they were able to see significant weight loss. And not only did they lose weight, but they also saw that through the lab tests they did, there were improvements in their insulin sensitivity and the inflammatory markers, right? So the lab tests that indicated how much inflammation they had in their bodies, they were better. Now, there are certain physicians who are trained and competent in supervising patients in therapeutic fasting. Now, you may have heard of intermittent fasting. It's gained a lot of popularity in recent years, but there is a realm in which it's possible to use fasting not only to reverse disease, but also to prevent it. And the field of weight loss or weight management, as we call it these days, is certainly one of them. And so it's been shown that there's an average of 4 to 10% of the total body weight that can be seen lost within 8 to 12 weeks. Um, Now, in addition to that, people are able to recognize that they have lower blood sugar levels, the waist circumference is smaller, and also they even have more energy. Now, when you're able to combine fasting, therapeutic fasting with a functional food, or you could call it an adaptogenic herb, which means it's an herb which has a lot of healing or therapeutic properties for the body, such as moringa. you notice that the results are actually better. The foods you eat when you fast are very, very important. And I find that people will come into the office and tell me, Doc, I've tried fasting before, but I'm not losing any weight. And my first question is usually, what are you eating, right? Outside of your fasting window, when it's time to eat, what exactly are you eating? It's extremely important to pay attention to that. Now, at Rofi, I have designed a weight loss protocol, and within this weight loss protocol, my patients are losing an average of 10 to 15 pounds of weight. In addition to that, they're keeping the weight off. Now, I don't know if anyone on the call can relate to this. Let's say you've lost weight in the past, but then you found out you gained it again. I've designed a protocol which, if you follow it, it works. In my first year of private practice, my patients lost a total of over 500 pounds of weight. I was speaking to one of my patients the other day, and she's actually a doctor. She's lost over 60 pounds and she's not yet at her 1 year mark. So I think we are doing something well. And so, for these reasons, that's why I want to just let more people know what is possible. And it's important to say that this is all without the need of medication. I don't have anything against them. I intentionally don't prescribe them at Rofi. I actually deal with patients who've typically been on Ozempic or Monjaro or what have you, haven't seen much success or have had side effects, and then they're now coming to go a more holistic route, I should say. So let's talk a little bit more about what the research tells us about moringa. So in 2019, there was a research study that was published in a journal called Nutrients. And one of the things it showed is that moringa, when supplemented, specifically the leaves, they help to reduce body weight, waist circumference, and also cholesterol levels, specifically LDL, which is the bad type of cholesterol in adults who are overweight. And I think it's important to know exactly how this happens. Moringa is something which I saw all the time growing up in Cameroon. I didn't think anything of it. But as time has gone on, I started to have patients who conventional medicine just was not working for them. They had tried all the things and they were feeling quite frustrated. Doc, I'm doing this, I'm doing that, but how come I'm not losing weight? How come my blood pressure is not being reversed? How come my diabetes is not being reversed? And we're finding that the benefits with this tree, the moringa tree, are just tremendous. What I'm speaking about tonight is specifically pertaining to the leaves, where every part of the tree does have some type of therapeutic benefit. So, how does it do this? One of the things moringa does is it suppresses one's appetite, and it does so naturally. Now, it has compounds which are called isothiocyanates. These are antioxidants. So, what they do is in the body, one of the reasons why people tend to get hungry or tend to have that appetite is because they actually have inflammation in the body. Inflammation causes one to feel like they need to eat more. But when you have something that's a natural antioxidant, it's reducing the inflammation, and that equally affects one's appetite. Another benefit of moringa with this same point is that it is loaded with vitamins and minerals. I actually no longer take a multivitamin because it has all the vitamins your body needs. It has all the protein. It actually has 2 times the amount of protein as you would find in meat, except it's more bioavailable. The body is able to break it down more easily because it's a plant, as opposed to meat that takes about 72 hours just to break down. Secondly, moringa also lowers blood sugar and insulin levels. And these are very important when it comes to the body's ability to be able to burn fat. And so, equally, that helps in one's journey when you're trying to lose weight. I mentioned earlier that it is loaded with antioxidants. In addition to the isothiocyanates, it also has quercetin, that's another antioxidant. And there's several more that I can mention. Again, when you reduce inflammation, you put the body in a state in which um, it's actually able to help lose the weight, shed the weight. And lastly, it supports the guts. These days there have been so many research studies talking about the importance of the gut, even calling it the second brain, and it helps with detoxification. So in the food we eat, in the environment we live in, there are so many toxic chemicals that can come in. These also contribute to inflammation. But when the body is in a state of inflammation, it's pretty much in survival mode. And this is one of the things that makes weight loss very challenging. So one herb, one tree, one leaf is able to come with so many benefits, in addition to the fact that, at least at Rofi, the way we have it set up is we tell you exactly what to do day by day, how you should eat, how you should fast, and then you have supervision. You have the ability to actually walk through the journey with your physician or health coach. So I think it contributes to why our patients have been so successful. And I think it's important that more and more people know about this. So this actually ends that portion of education. And I want to pause here because I'm going to tell you what you can do next. But there are three main next steps for you. The first is to decide, okay, I want to come on board. I want to become a part of the Rofi community. Perhaps you're someone who's been told you're borderline for a certain chronic condition like high blood pressure or diabetes or high cholesterol, and you want to come on board. I did not anticipate this, but appointment slots are filling very quickly. And so we have a mixed model. We have concierge medicine, wherein our patients are part of a membership for a set monthly fee. They have access to the physician. It enables me to be able to monitor their vital signs, how they're doing throughout their protocols, whichever one they're on. But it comes with that 24/7 physician supervised fasting. Everyone receives a personalized protocol because everyone's body is so different. A meal plan which really caters to the meals you actually like to eat. And I think it's important to mention because, again, I grew up in Cameroon. This is not the time. If you don't like radishes, if you're trying to lose weight, I don't know that this is the time to go and start eating things you don't like. It's hard to be consistent when you do that. But we are able to create meal plans that actually factor in the foods people like to eat and that they're familiar with, to help them to be able to lose weight. We review your lab results. And in addition to that, coaching is available. So the concierge membership starts somewhere around $350 for all of that per month, and it goes up to about $750 depending on what you want to have included. And I can certainly talk more about that. Now, in order to increase access, we also have insurance providers that we take. We take Aetna, Blue Cross Blue Shield, Cigna, and United Healthcare. So you might say, all right, doc, maybe the concierge model may not be the best, but I want to still be seen and I have insurance. So I'm currently contracted with those four insurance companies, and I'm licensed in Maryland, Virginia, and Connecticut. But in the virtual world, thankfully, you don't have to travel. You can be seen from anywhere, really. And so again, we're able to help you, give you that guidance. Of course, there isn't nearly as much as is included in the concierge membership, but it gives you something to work with. And thirdly, you might decide you want to try Moringa. And if you scan the code, you have the option to go with either of these options today. If you click on start here, it will walk you through a form and you can immediately schedule your appointment. Or if you just scroll down a little on the website, so I think the fourth portion, it will show you the Moringa pods and you can purchase it today. Now, I've shared quite a bit of information. I'm actually going to stop sharing here and I'll actually like to open it up to you all. So, do you have any questions? Do you have any thoughts based on what you have heard tonight? What thoughts come to mind? What are the things? What are the struggles or the challenges that you've even had when it comes to weight loss? Let's talk. Feel free to ask in the chat or you're welcome to unmute as well.
Hi, Dr. A. This is Anika. Sorry, I'm on my way back to school.
No problem.
I think for me, the main challenge has been actually being consistent because I'm actually taking Moringa. It's amazing for my period. I didn't know it actually helped with weight loss, but it has helped me with my period, especially with my face. My face used to break out a lot when I was getting my cycle.
Mm-hmm.
it no longer happens. But I didn't know that it actually helps a lot with weight loss, which makes sense. And I actually got some lab work, and my doctor told me that I was doing like really well. Like everything looks really, really good, and whatever I'm doing to keep on doing it. And I was saying that the only thing that I actually changed was like I just started walking more, moringa, and I started drinking a lot more water. Um,
Mm-hmm.
the only thing I changed. So, in terms of like the weight loss aspect, I feel like being consistent with it has been my issue. Yeah, because I could take the even like the moringa. Like sometimes I take it every day, every morning. But if I'm traveling, like if I'm coming back home, sometimes I forget to take it because like the change of routine. It's like I don't know if you have
Mm-hmm.
for that, how to like be a little bit more consistent, or if this course goes the concierge model goes along with that.
Yeah, first of all, I'm so happy to hear that. I'm so happy to hear that. It's always great when you hear how people are doing, and I'm so happy to hear that, your blood work looks great. You've seen the benefits with your period, you've seen the benefits in your skin, and that's why I love moringa so much because I don't believe in being on 10,000 medications. That always bothered me when I was going through my training. I just never felt like that should be necessary for patients. And it's just not what I signed up for when I said I wanted to become a doctor. Now, to your point about consistency, I can understand and I can also relate. So, what I would say with that is I think the nice thing is it comes in a pack of two, right? The moringa, which we have at Rofi. So, what I do personally is I have one pack at home and I have one pack in my bag, like especially with my lunch bag. So, especially when I'm on the go and I'm traveling, I make sure that I have it with me because it's possible, right? We're human. It's possible that maybe whilst you're running out the door, you might forget to have it or take it, especially if you might not have as much time. But I find that if I have it with me when I'm on the go, it makes it a lot easier. The other thing I find that's helpful is honestly setting an alarm on my phone, and this goes for anything in general, just making sure whenever I have something on my calendar, because it's at a set time, I have a reminder, then it helps with that routine creation, that consistency. And the beauty of you mentioned it, the concierge model, or even my insurance patients, if you know that you're going to be following up with your doctor, whether it's for the purpose of weight loss or chronic disease reversal, because you have that accountability in place, it actually wires your brain for consistency. It helps you. This is why people who get personal trainers, they actually tend to do quite well when they tend to go to the gym, as opposed to saying, oh, I'm going to work out, I'm going to be the most consistent and disciplined person in the world. It just helps to have that support. And one thing, a wise woman once said, no man is an island, right? And this is so true. As a doctor, I believe my job, first and foremost, is to be a teacher, to actually help patients learn about their health. That's why we're talking about this. What exactly is this thing called moringa? It's not just say, take it. No, I want you to understand exactly what you're taking and what it's even doing to your body. So the understanding, I think, also adds a level of consistency because you now understand why it's necessary to even take it, how exactly it's helping your health. Just like blood pressure medication, if you don't take it, you know the impact it's going to have on your health. So I find that with patients, it helps them to also be more consistent. So thank you for sharing that. And I hope that's helpful. Let me know.
Yes, that's very, very helpful because I've seen the results. Like I've firsthand experienced the moringa, like the results of it. Even like losing weight, everyone's asking me like, "What am I doing?" And I literally am like, I can't even tell you because I don't even know like what I changed about. But that makes so much sense because I feel like whenever I see the results, sometimes because I see it, I slip back into the old cycle of like, oh, okay, I don't have to take it today, or slipping back into that old cycle. So the accountability is really nice. Yeah.
Yeah. Yeah, we thank God. We thank God. And so let's talk more actually. If it's helpful, if you want to take it to the next step, if it's helpful to have like a personalized protocol for you just to kind of address things from the food side. I truly believe in food as medicine. And if you want to create some consistency around that too, let's maybe schedule an appointment and let's make it happen. We have a question in the chat. What are the components of moringa? So that's a great question. I'll answer this from two fronts. One, what's in moringa at Rofi, and then what is moringa, right? Just generally speaking. So I'm very intentional about clean products and having very few ingredients in things. So moringa at Rofi, it's literally just moringa. It's literally the leaves of the tree, which are taken off and they're ground into a powder. And it's important to say that this is done in clean, sterile, sanitary conditions in a lab. I did not want to send my patients off into the world of Amazon and just say, take anything. If I'm going to recommend it, let it be. If anything goes wrong, you could say, Dr. Larissa, this is your fault. And I'll take full responsibility. But there's a lab I've partnered with, and they actually do all the packaging, they do all the harvesting, they actually grow the moringa themselves outside, of course. And then when it's time, they take the leaves, they make it into a powder, and then they package it into what we have. That's it. Now, we are rolling out a few other things, and when those come, I will equally explain what is in them in terms of ingredients. But just to be very clear, the moringa powder, that's the only thing. Now, we do also have a moringa honey soap because some people do have different skin conditions like acne, eczema, even stretch marks, dry skin, sensitive skin, etc. And moringa is also skin food. It also helps to take care of the skin from, or the body, I should say, from the outside through the skin, which we know is our largest organ. So, in that regard, the Moringa honey soap, there are other ingredients, but they're all listed on the website and intentionally kept under, I think it's a maximum of 5 ingredients in total, which are all natural. It's a vegan soap, it's organic, all the things intentionally. Now, in terms of moringa itself, moringa doesn't have like other ingredients or components because it's a tree, right? So it has roots, it has the like a bark, like a tree, but specifically we are bringing the leaves out first. That's what you're going to get when you get the powder, the leaves, the ground leaves, and they have a ton of nutrients. There is 12 times as much vitamin A, for example, in moringa as what you would get in calcium. In carrots, it has 2 times the amount of calcium that you would get in milk. So people who have an issue with leaving dairy or feeling like, how can I get more calcium if I don't drink milk or eat other dairy products? This is actually a great way to be able to get more calcium into your diet. I mentioned earlier, it has 2 times the amount of protein as what you will get in meat, and it's more bioavailable. It also has the same amount of iron as is found in the iron pills. But the best part is that it's more bioavailable because it's natural. It's just a leaf. Your body is able to break it down more. But the iron supplements, they come typically at like 65 micrograms. They come in a capsule. So anything that's in a capsule, your body is never going to absorb the full amount. So even though it says 65 micrograms, your body will not absorb all of that because it needs to be digested. So what happens is that in that process, sometimes people can even experience some side effects, nausea, vomiting, abdominal pain, even constipation with the iron supplements to treat anemia. But this is a great option. And this is actually what made me start offering moringa. Anemia is the most common complication in pregnancy worldwide. And this is what made me start moringa, because start bringing it to Rofi, because I had a lot of pregnant patients and the iron supplements just were not working out for them. So rather than having people go to get transfusions, this was a natural, safe option for them, very well tested in mothers and in very young babies, actually used in several parts of the world in which people are not able to have 3 meals a day. This is a great way. 1 tablespoon gives you all the nutrients your body needs for a whole day. So I could keep going, but it is loaded. And that's why I think these sessions are so helpful, because truly we just have to parse this thing out bit by bit. There's so much to say about moringa, so much. Do we have any other questions or thoughts?
Yeah, I have a question.
Yes,
I'm
please. Go
actually
ahead.
gonna show my face.
Okay.
Oh, okay. So hi, let's see. Yes, hi again, and thank you very much for that wonderful presentation. It's very um um enlightening. I just out of curiosity, does that help? Does the moringa help um your mental health at all?
Mm,
But my main question is because I was actually looking for as we get older,
mhm,
we are needing more to pay attention to what goes into our bodies. And so I've
mhm.
been researching like what vitamins I really want to get because I'm not taking any vitamins. So I was trying to see what I mean, I was looking for what's more like more bioavailable as far as vitamins, and I'm really excited about this. I'm hoping and willing to try it. But like how much of the moringa do you have to take to effect any kind of weight loss
Great questions.
on a
Great
daily
questions.
basis? Mhm.
Great questions. So, thank you for asking. So, the first question about mental health, I'm going to do a session on how Moringa impacts your mental health, specifically speaking on it from the lens of depression. So, it has been shown to have, because it's loaded with antioxidants and other compounds, I'll get into more detail during that session. It has been shown, thank God, through the research to play a role in helping people with their mental health. The other thing worth mentioning is, these days people are getting more and more diagnoses of Alzheimer's disease, which we are calling in the scientific world loosely type 3 diabetes. So, understanding that having something like this, which helps to reverse metabolic syndrome, any type of metabolic disorders, pre-diabetes, diabetes, it plays a role in being able to reverse the risk of having an issue like Alzheimer's, dementia, etc. Now, every person is different, but I do typically love to approach things on a case by case basis and from a root cause perspective. The other thing I think is amazing is that because it's a leaf, right? The body does this amazing thing with certain items. It's a very smart system. It digests everything, it takes what it needs, and you pee out the rest. So, as you consume it on day one, you may or may not notice some improvement, but give it 3 days, give it a week, give it a month, right? You will then start to see different changes. And I know for myself, if I can use myself as an example, when I first started having moringa, I didn't see anything on day one necessarily, but now my body has actually, and it kind of came very subconsciously, but I would say probably after a week I could tell very clearly. And also I was quite busy, so I probably wasn't paying too much attention, but I noticed that on the days when I start my day off with moringa, I'm less hungry. Also, on the days when I don't have it, I can tell the difference. I have significantly more energy when I have it as opposed to when I don't. And because I love intermittent fasting and it's something I try to do regularly, I notice the difference. I notice how I even feel mentally. Fasting has great benefits for mental clarity, but adding something else like moringa, I think it just takes it to another level. And again, these are all things which are non addictive, no side effects. And I think in today's day and age, that's very important. Um, and you had asked another question, how much you would need every day. I usually recommend at least a teaspoon, ideally a tablespoon every day. So it comes as a pack of two. And so you're able to really use it for at least a month, if not more. Most people, I would say, are using it somewhere between 4 to 6 weeks, the typical package that comes from Rofi. You can put it in everything. You can put it in your food. Growing up in Cameroon, in the northern part of Cameroon, actually, there is something called moringa soup. So people actually cook it into a soup, kind of like pepper soup. I've even made a version, if you're familiar with that meal, I've made a version of pepper soup using moringa, and I thought it tasted great. So personally, I love to put it in yogurt. I love to put it in soup. I love to have it as a tea. That's probably the most common way in which I have it, but that's what I would say. So I hope that answers your question. And I've also put the link in the chat just for your convenience. And I'm going to put the Rofi website in there as well. So let's see if we have any more questions that come through.
I have another question.
Yes, please.
Yeah, so for those that want to use the insurance, how does that work?
Oh, that's a great
Can you go
question.
over that?
Mhm. So I just put the Rofi website in the chat. And so if you just click on the website, the first button on the website says start here. So once you click that button, it will lead you to complete your information and schedule an appointment. It will ask you for your insurance information, and that's it. So that's all you have to do.
So there's no copay or anything?
I think it depends on your insurance. So if you
Okay.
have insurance, once the appointment comes through, we will review it on our end. But if there's a copay, we'll certainly let you know before the visit. But that's a case by case basis. It just depends on the insurance plan that you have.
Okay, thank you.
You're welcome. Do we have any other questions? Okay. One last thing I would love to show you is actually our topic for next week. So, next week, we will continue the conversation. So please, if this was helpful, make sure you share it with others. Next week, I'm going to be dissecting a research study again. And next week, we're going to focus in on hypertension. So if you have questions about hypertension, you want to know how Moringa can play a role in this, or how therapeutic fasting can play a role in this, and hear even some success stories, which I'm so grateful we've had so many at Rofi at this point. Please make sure you come. It'll be same time next Monday by God's grace. So I cannot wait to see you there. So we'll be talking about reversing hypertension. It will be the same link. You can join. And I'm already excited. I'm actually really, really happy. If you have some feedback on tonight's session, actually, I would be most grateful if you would not mind. You could either just share it in the chat just so that we know and we can kind of let people know more about this, right? And I saw someone say this was really good. Thank you so much. So grateful. And if there is anything else, you can actually just, I'm going to put a form in here. And if you don't mind just taking, it takes like, I would say no more than a minute to go through this form. It's very short. If you could please just complete that, I'll be so grateful. And then we can use this to let more people know about the sessions. But I see another comment. Thank you. It was very interesting. Thank you so much. And thank you for joining as well. Any final questions before we conclude for today?
I have a quick question. Good evening,
Yes.
Dr. Larissa. God bless you.
Please.
So for the moringa, say if I'm taking tea in the morning, would you recommend a tablespoon or a teaspoon for the tea, like 12 ounces of tea?
For 12 ounces, I think if that's all you're going to all the moringa you're going to have for the day, I would say I would recommend a tablespoon. And I should also say I would recommend steeping it for maybe like 5 minutes. That just allows a little bit of time for it to brew so that all those helpful chemicals can be released, or helpful nutrients, I should say. Um,
Wait, I'm
yeah,
sorry, you said to let it sit for 5 minutes or
Like
okay.
just like you would let a tea bag steep, it's the same thing.
Okay.
It doesn't mix very well. I always say moringa is just, it looks like matcha and it kind of acts like matcha. If you notice, a lot of people who have matcha, they'll whisk it to mix it in.
Mm-hmm.
It's similar. It looks the same. It kind of acts the same, except it has no caffeine and it's loaded with way more in terms of like vitamins and minerals, etc. So that's what I would say, if you're going to have it just once. Now, for me personally, I will take that tablespoon, I'll mix it in. And talking about routines, when I know I'm working, I'm going to just take it in my tumbler and I'll drink it throughout the day. I love to do that. So,
Okay.
what are you'll kind of try it, and I actually would love to hear from you all. Maybe next week, if you guys have it already, let me know next week how you've been having it, what's been helping you to stay consistent, and then we can all learn from each other. But that's what I would say in a nutshell.
And then say like usually I'll have coffee in the morning, so
Mhm.
it's okay to do both coffee and the or is that too much?
No, no, it's okay
Okay.
to do both. Now, I'll be honest with you, need you might notice you don't need as much coffee. And this
Okay.
is coming from someone who would drink a lot of it. Working 80 hours a week in residency, I was saying to someone, I feel like I have more energy than when I was drinking all that coffee back then. So I would love to hear actually what you think after, maybe give it like 3 days and see how you feel.
3 days of drinking just the tea with no coffee.
Or you can start with both and then try one day. The nice thing is, I would say it's a leaf, right? So your body's gonna break it down. There's very generally, if things are safe in pregnancy and with young children, you're in the clear. We have very little to worry about by the grace of God with interactions and all of that.
Thank you so much.
You're welcome.
Okay, I have another question,
Yes, please.
Dr. Larissa. So I'm not sure how to ask this, but hopefully I can make myself understood. So
Yes.
as far as when you talk about the your community,
Mhm.
so is this something that you're going to be opening it up to other professionals like yourself to maybe be able to incorporate this in their businesses or in their practice, or is it something that's solely just going to be coming to you? I'm not sure if I even make myself understood.
No, thanks for asking. So let me see if I let me ask another question to make sure I
Okay.
understand. So
Mm-hmm.
let's say there's another doctor like Dr. Sarah, and
Mm-hmm.
let's say Dr. Sarah she's a great doctor, right? And she wants to bring Moringa to her practice as well.
Mm-hmm.
It's something
Mm-hmm.
which I'm going to make available to other doctors so that they can also bring it to their practices.
Yes, as part of your community, are you going to be able to extend yourself like that, or is it just going to be like a pattern type thing where it's solely your thing and you just have to be like a patient, or that's it?
Ah, I see what you mean. I think I understand. Let me try to
Okay,
to answer and you let me know. So
okay.
I don't believe that I'm meant to be, I don't believe that I am the perfect doctor for everyone in the world. I always say that
Mm-hmm.
to my patients. And I think there are a lot of great doctors out there, and I love to collaborate with my colleagues. So if anyone on here, by the way, is a physician and you'd love to collaborate in some way, shape, or form, please let me know. Number one. Number two, um, I think that so Moringa is a product. So as it's available on the site, anyone anywhere can order it, right? There is no restriction there. You don't have to be a Rofi patient at all. But if you feel like it would be helpful, you want to take it to the next step, you want to lose weight, you've tried other things and you want to kind of be a part of the protocol that we have been running at Rofi and you're looking for a doctor, then by all means, I'll be more than happy to have you. But I would love to collaborate with my colleagues, certainly. It is copyrighted, the protocol which we have. So at this point, there's no problem with sharing it. And we're doing a lot of work behind the scenes. So there's a lot more that will be rolled out in due time. But absolutely happy to collaborate. Moringa is available to all. But if someone is looking for a doctor and they want to try this approach, and you're looking for a doctor comfortable with supervising therapeutic fast, then certainly Rofi is open.
Okay.
Did,
Okay.
did I answer your question?
Yeah, you definitely answered my question, and I was asking that because I'm a nurse practitioner on
Okay.
my own practice, and I would love to
Yeah.
collaborate.
Yeah.
But in the here and now, I think I'm just gonna be a patient. I mean, I do offer semaglutide and tirzepatide and all that, and ask me why I haven't
Mm-hmm.
got on it for reasons, personal to me. And,
Mm-hmm.
everybody wants a quick
Mm-hmm.
fix. Like I was telling you, I was chatting with
Mm-hmm.
you earlier on. But I'm
Mm-hmm.
looking for what is, more um beneficial to my body because, of what I know
Yes.
about those products and all of
Yes.
that. And I would rather take the natural route with
Yes.
something like Moringa. And so that's why I'm very much interested in this and hoping to collaborate and be able to offer that too, alongside, what everybody else is wanting in the tirzepatides and semaglutides of the world. Yeah.
Yes. Well, I would love to talk further. I love that, and truth be told, I as one person can only ever reach so many people. And like I said, especially if you already have patients, you have a great relationship with you. Yes, please.
Hmm. Yeah.
Let's talk about it. I think it's great. Certainly see how it goes for yourself. Because when you're sold on something, then I
Yes.
can talk about this in my sleep because I believe in it so much. And I've seen how it's helped me and it's helped my patients. So I feel like I can speak very boldly and confidently about it. So when I'm sold, then I can talk about it, the pros and the cons, right? Like I'll tell you the earthy taste, I'm not the biggest fan of it, but I know that when I add lemon or lime, it's perfect. It's perfect for
Hmm.
me. I have patients who actually like that about it. So we laugh about these things. But I mean, for similar reasons, that's why I don't prescribe Ozempic and Monjaro and the rest. I don't have a problem with them. I have a lot of experience prescribing them and managing them. But with the mandate specifically I have at Rofi, they just don't fit, right? This is
Yeah.
all natural root cause medicine, functional medicine. So we are bringing the functional foods to the world. And truth be told, I didn't know about a lot of these in medical school. These were not taught to us. So this is really a lot of research that has gone into the works over time. So yeah, and I look forward to collaborating. Thank you for even considering that.
Of course, I'm excited. I'm excited. It's, you want to do for your patients what you do for yourself. And so
Yes.
that's the thing. Like that's why I
Yeah.
said I have to try it first, of course, to be able
Mhm.
to better understand it and better be able to present it to my patients. So I'm really excited.
Yay, I'm excited. We have to stay in touch.
I know, sure.
All right. Do we have any other thoughts, questions? We're at 9:50. I can actually give you back some time. This is good for me. I think this has been informative. I hope. Thank you so much for all the feedback in the chat. I really appreciate it. And like I said, if anyone's able to complete the form, I would be most grateful. But we will be back, God willing, same time next week. I'm just going to pray us out. And I just say thank you again for joining. Thank you, Lord, for this opportunity to meet tonight. Thank you for every single person, oh Lord, who was able to tune in tonight to tonight's session. Lord, we pray that the information which came forth will go and create impact, oh God, in all the ends of the earth. We even pray, oh Lord, that all who, even as people try Moringa, oh God, may they experience the benefits that you have put within it. We pray that this will go and help patients worldwide. We pray that all who have decided to come on tonight, that you would even give them back their time. You will give them opportunities to have time, resources, all that they need, oh God, in order to remain in divine health. We thank you again for your goodness. We thank you for your kindness, oh God, and we give you all the glory. In the mighty name of Jesus, we prayed. Amen. Amen. Amen.
Dr.
Good
Larissa,
night.
I'm sorry, I have just two quick questions.
Yeah, go for
Okay, the
it.
first one is it okay to take moringa on an empty stomach?
Oh, yes. Yes,
Okay.
please. Because I literally recommend it with fasting. I actually think it improves the absorption because there's nothing else to compete with. That's what I do. Because when I'm drinking it, for the most part, at the beginning of the day, I haven't eaten anything. So it actually will help the absorption.
Okay, you just answered the second question. The second question was, is it okay to take when fasting?
Oh,
Yeah.
yes. Yes,
Okay.
please.
Okay. Thank you.
In the Rofi,
Mm.
you're welcome. In the Rofi protocol, it's part of it to actually take it whilst you're fasting, during your fasting window. So, absolutely.
Thank you so much. God bless you.
God bless you. Okay. Good night, everyone.
No.
Thank you again for coming. Bye.
Mm.